Club of Portland's Friday Forum, Oregon's premier public affairs forum. I'm Sue Thomas, president of City Club, and I welcome you all. Those of you here at the Governor Hotel, and those of you listening on OPB or KPBS radio or watching on cable television. Thank you for joining us for this week's Friday Forum on this, the 10th of July, 2009. Today we welcome Bruce Goldberg, Director of Oregon's Department of Human Services, who will discuss the changes that the DHS is making in order to better address the needs of Oregon's most vulnerable citizens. But first, some announcements. In consideration of those sitting close to you and those in our radio and television audiences, I ask that everyone in the room who's not already done so to please silence your cell phones and other devices that make noise. Thank you. As always, we offer our appreciation to our Friday Forum corporate sponsors for this quarter, without whose generous support, these time-honored City Club Friday Forums would not be possible. This week, we are extremely pleased to thank the Confederated Tribes of the Grand Ronde for becoming City Club's newest sponsor and supporter, and we also thank the law firm of Stoll Reeves for their support. Please join me in thanking our sponsors. If your company or firm would like to join City Club and be a sponsor of these Friday Forums, please contact the City Club staff at the back of the room or call the City Club office. City Club's popular citizen salon dinners and discussion series are continuing with intimate dinners and informed discussions on a wide variety of topics, from the role of the chef in a progressive society to Portland's urban chicken population. Yes, that was chicken population. To register for upcoming salons, please go to the City Club website. Next week, on July 17th, please join City Club for an address by Preston Pulliams, the district president for Portland Community College, who will discuss the goals and the future of Portland's largest and most diverse institution of higher education. And now to today's program. After receiving his medical degree from Mount Sinai School of Medicine and his family medicine training at Duke University, today's speaker spent more than 15 years as a faculty member at Oregon Health and Science University. His professional experience also includes serving as a health officer for Oregon's Columbia County, as medical director for Care Oregon, and as a head for the Office of Oregon Health Policy and Research. Widely published, he has served on numerous regional and national advisory boards and committees and is currently chairman of the National Policy Council at the American Public Human Services Association. In 2002, our speaker received a Lifetime Achievement Award from the Oregon Public Health Association. He assumed his current position as director of the Oregon Department of Human Services in November 2005, and has since focused his attention on expanding children's access to health care, reducing hunger and food insecurity, and improving the state's mental health system. Please help me welcome today's speaker, Dr. Bruce Goldberg.
Thanks, Sue. I really appreciate the kind introduction. Thanks to the sponsors, and welcome everybody. As you heard, my name is Bruce Goldberg, and I'm the director of the state's Department of Human Services. We are the state's largest public agency. So let me put that introduction in another way. Hello, my name is Bruce, and I'm a bureaucrat. Now, I know that's not what you were expecting, nor what I was expecting as a career path when I graduated from medical school. But after working as a physician in North Carolina, the Indian Health Service for 6 years in Zuni at Oregon Health and Sciences University, I really came to see the tremendous difference that excellent medical care can make in a person's life. I've also come to see what good public policy, what well-run programs, and what supportive communities can do to improve the lives of thousands of people. I never thought I would end up as the head of the Department of Human Services, but I took the job because I profoundly believe in the potential of our public institutions and for the opportunity to improve lives of so many Oregonians. In essence, to be able to make a difference. And the truth of the matter is, and I was telling this to Sue at lunch, that I've got the best job in Oregon and maybe one of the best jobs in the country. So I'm here today to talk to you 3 years later after taking this job to make the case to you that some of the most exciting and innovative work happening in the country today is happening at the Oregon Department of Human Services. In 1977, Hubert Humphrey said that the moral test of any government is how that government treats people at the dawn of life, the children, how it treats people at the twilight of life, the elderly, and how it treats those who are in the shadows of life, the poor, the sick, the needy, and the handicapped. More than 30 years later, I don't think those words are any more prophetic today. But in Oregon, there's a second test that we always have to think about. It's not simply about whether we're doing the right things by our most vulnerable citizens, but it's also about whether we're doing the smart thing for the entire state. So what I'd like to do today is talk about the challenges of meeting those tests, and specifically to talk about three things. First, I'd like to outline what some of the real human service needs in our state are. Second, I really would like to talk about how government's got to change if we've got any hope of meeting those needs. And third, talk about how smarter and earlier investments can help us improve lives, protect precious resources, and build stronger families and communities. For those of you who aren't familiar with what is really your Health and Human Services Agency, we run what is in essence a safety net. Simply put, we help care for seniors, for people living with disabilities, for children, those who have had a temporary hard time and need a hand up. And it's not lost on this room that during the last year, that safety net in Oregon has really been pushed to the limit. I think, as you know, the unemployment rate statewide is now over 12%. That's the highest in memory. And last week, it was announced that right here in Portland, that Portland had the fastest growing unemployment rate of any city in the nation, faster even than Detroit. By our most recent calculations, 1 in 8, or 13% of Oregonians, live in poverty. And that was before the economic downturn. Certainly, there are many, many more in our state today living in poverty. Last month, 1 in 6 Oregonians qualified for food stamps. 1 in 6. Look around you. If this room represented Oregon, one person at every table wouldn't be able to feed their family and would need to rely on the help of the state and the federal government to do that. 600,000 people, 1 in 6 in this state, are without any kind of health insurance. More than 260,000 people here in Oregon suffer from alcohol and drug abuse. And probably more importantly, less than 25% of them have access to any kind of treatment. Untreated drug addiction costs all of us, not just in the human lives that it affects, but it also takes an economic toll on all of us. Eco Northwest has estimated that the cost of untreated substance abuse in this state is $5.93 billion a year. An astounding statistic, $1,600 per Oregonian. About 7% of the Oregon population lives with mental illness, and too many have a hard time finding treatment in their community. And because they can't get that treatment, they end up in jail, they end up in hospitals, or worse, they end up dead. And I think all of us know that Oregon has far too many of these stories than we would care to really take ownership for. And since this lunch began today, a Department of Human Services hotline received a call from somebody indicating that they were concerned that a child was being abused or neglected in our state. During this luncheon, we'll get 6 more such calls. We get one every 8 minutes, 64,000 calls a year. And then finally, on the opposite end of the lifespan, we have a coming wave of senior citizens. No, I'm not talking about people invading us from Florida or Arizona. It's about you and me. Well, it's about you. I'm not getting older. My daughter has certified that. I'm getting younger, but the rest of us are getting older. And I know that Portland has a national reputation for being a young city. We have a new creative class. But the reality is that the state of Oregon is aging. It's getting older, and that's going to have serious consequences for our public policy, for our government, and for our state budget. Next year, the population of Oregon that's over 65 will be 13%, and it will nearly double over the next 20 years after that. And the issue there is that since Medicare, our nation's health insurance for seniors, doesn't cover the one thing we're all going to need as we get older, which is nursing care and in-home care to keep us at home, long-term care, many of us are going to impoverish ourselves, become destitute, and then turn to the state for help. So you can see I am filled with nothing but optimism today. But in all seriousness, from where I sit, I know the toll that these human service needs have on our state. And after hearing these statistics, you may be questioning my statement about having the best job in Oregon. But I'm in a really unique position, and I know what we need to do to address these problems. And the bigger issue is that I know that to do this, good government matters. That's a lesson I think all of us learned, particularly from Hurricane Katrina. Several years ago, the citizens of Louisiana and Mississippi were left abandoned and bewildered as the rest of the country really watched in horror. A subsequent report by Congress showed that disengagement of government at the top levels and an unwillingness of government to bulldoze through barriers and do the right thing resulted in a true human calamity. The report concluded and said simply this, and I quote, "This is a congressional report. Katrina was a national failure, an abdication of the most solemn obligation to provide for the common welfare." So in the aftermath of Hurricane Katrina, there was a lot of analysis. It was analysis about whether large government failure was indeed inevitable. The question was raised, is it even possible for government to do anything right, to do anything at all? Then in Oregon, we had another storm. You may recall in December of 2007, a massive front came to the state, 100-mile-an-hour winds. The town of Vernonia flooded, underwater, decimated, forests blown down on the state, people lost their homes, roads washed out, people were left homeless, they were left isolated and alone. And in Oregon, government actually responded. At DHS, in our organization, many of my employees living on the coast themselves facing flooding and perilous conditions for their families showed a tremendous initiative and a dedication that really exemplifies why people come and work at our organization, which is really to help people. They went door to door, checking on individuals, brought medicines to seniors, helped evacuate nursing homes, went and checked on foster children so they could contact their parents and tell them that they were safe. We were on the ground in Vernonia getting emergency food assistance and food stamps to people who had lost their entire lives, emergency cash assistance to individuals who, in the course of 12 hours, had lost a home, all of their money, everything. What happened is our staff didn't let red tape or bureaucracy get in the way of getting the job done. Because the issue is that in an emergency, you do things differently. Suddenly, you're free to think about and do things in an entirely different way. So today, it's really not a rainstorm. It's a beautiful day here in Oregon. And it's not a windstorm, but we have a human storm. We have a human emergency. We have a health and human services emergency. The growing numbers of seniors that I talked to about, the numbers of people with developmental disabilities, the numbers needing mental health care, the abused and neglected children, that's an emergency. That's a storm, and it's happening right here in Oregon each and every day. So what we've got to do is take some lessons from Katrina, from the December storm, and think about things differently, and do things differently, and respond to this emergency. And that's what I want to talk to you about. I'm happy to tell you today that at DHS, we're doing that. If you don't believe me, ask President Obama. Last January, people across the country were watching the inaugural address. I think probably most of us in this room were. And we listened to President Obama lay out his agenda for the country. Foreign policy, domestic policy, and that's certainly what we all expected him to do. But what he also did, what I certainly wasn't expecting to hear during his speech, was to describe the transformation that we're undergoing at the Department of Human Services. About halfway through his speech, he began talking about government as a factor for good in this country. And he said, the question we ask today is not whether our government is too big or too small, but whether or not it works, whether it helps families find jobs at a decent wage, whether it can help them get care they can afford, a retirement that is dignified. He went on to talk about the importance of being innovative, about thinking long-term, breaking through bureaucratic barriers, and that keep us from doing our jobs. And he did something really important. He called on government to restore the public trust and strive for greatness. I couldn't have described any better what we're doing every day at the Department of Human Services. You know, a few months after I started my job, actually it was when I started my job, the Department of Human Services, 3 months into a new 2-year budget cycle, found itself $172 million in debt, and by any stretch of the imagination had lost the trust and confidence of the legislature and the public. Add to that the continual struggle the department was having in continuing to meet the growing needs in the face of declining revenue. So we started to ask ourselves some difficult questions. What would it really take to have a truly great world-class human services organization? The kind that every Oregonian would be proud of. What did we have to do to get there? It was pretty clear that the old ways weren't working. We had to change. So with the approval of the governor and the legislature, we brought in a global consulting firm that's a leader in teaching businesses and organizations to run more efficiently. They used methods familiar to many in this room today that help teach businesses how to operate better. Methods such as lean management, that the way that businesses and all of us need to relentlessly look for and eliminate waste, re-engineer our work processes and our workflows. The techniques used by the most successful and innovative companies in the world. It's how the Japanese learned to re-engineer cars and why Toyota now makes the best car at the best price. We figured if Toyota deserved the best, why not us and why not our clients? And the results were illuminating, and at times they were surprising. I'll confess that there was some uneasiness about bringing in this consultant. You know, workplace efficiency is seen by some as merely a euphemism for corporate downsizing. There was a fear that they would come in and recommend massive layoffs, budget cuts, simply for efficiency's sake and to make us better. And to be honest, I think that's what the consultants thought as well. But they found instead that there's really a key difference between government and business. And here's what it is. In business, when demand goes up, you increase your capacity and you generate more revenue. For us at the Department of Human Services, when demand goes up like it is during this recession, demand going up for food stamps, demand going up, more people uninsured coming onto the Oregon Health Plan, there is no more money. In fact, there's less money. And in business, if you can't keep up with, if your demand is so great and you can't keep up with production, well, people might have to wait a few weeks more to get that car delivered. Or a store might run out of the holiday season's hot toy that's being produced. In our business at the Department of Human Services, when there's a backlog and a delay, people don't eat, children are unsafe, and seniors are put at risk. So in other words, we can't run like a business. To be totally honest, we have to run better than a business. There's no doubt about it. So we dug in. We brought in the lean method of improving the work that we do at DHS. And we embarked on fundamentally changing our culture. We wanted to become more transparent, more accountable, and better at what we do. And after more than a decade of increased demand and lack of investment in human services, the consultants told us that there were some areas of our agency that we were between 10 and 30% understaffed. These are the corporate downsizers, particularly in many of our direct client services, such as child welfare. To fix this wasn't going to simply mean we needed more staff, but we had to re-engineer our workplace and think about how we do things differently. Part of that came by asking our employees. I'll tell you, That's a nerve-wracking experience for any boss. Our employees were asked, what drives you to come to work every day? Are your clients getting the best service possible? What needs to change? What's getting in the way? If I were to ask you what you think motivates our employees at DHS to come to work today, what I usually hear when I ask folks is job security and benefits. I know that stereotype, and I fight it every day. Quite frankly, all of our employees fight it every day. I'm happy to tell you today that you're wrong. The single motivating factor that keeps individuals coming to work, over 10,000 employees in the Department of Human Services, is a desire to help people, a desire to serve, not job security and not benefits. It's really about a desire to help people. So. And thank you for recognizing our employees, because they're really wonderful individuals. And you know, they're not very much different than you or I, because what I learned is that there was a deep level of frustration amongst our employees with the unnecessary work that they were doing, with outdated policies that keep them from doing their job well. And I can tell you, the most vitriolic anti-government blog is no match for a DHS employee who knows what needs to be done to help a client and is frustrated because of the red tape and bureaucracy that's getting in the way. It's amazing. Employees, are like Oregon taxpayers. We are Oregon taxpayers. And our employees want more accountability, more transparency in state government. That's something we could really work with. So we launched this initiative to transform ourselves, which is really about eliminating the barriers, letting workers tell us what needs to get done, and then getting out of their way and letting them do it. And before you start to sink into the deep folds of cynicism that we often sometimes slip into, let me tell you, it came in the nick of time. And let me just give you one example about how we've been successful, because I think this tells a lot. I think you know this past year in Oregon, it's been extraordinarily difficult for all of us and for families in the state. The need for food stamps and for emergency cash assistance has gone up 30% in the last year. It's been absolutely astounding. And it's likely to go up even more over the next year. People have been streaming into our offices every day in all corners of the state. They've had long stretches of unemployment, they've exhausted all of their resources, and they find themselves in desperate situations, and they come in for help. In some counties in Oregon, 25% of the population, 25%, need food stamps to help feed their families. Very quickly, we started to see backlogs and long wait times, benefits were being delayed. And that simply isn't acceptable in our line of work, as I told you. So, like in the storms, we declared an emergency. We said we've got to do things differently, we've got to think about things differently. And using those lean techniques, our frontline workers went in and they totally broke apart our food stamp eligibility system, re-engineered it, made it more client-focused, took out all the waste, and made it more efficient and effective. And it worked. It really worked. It was great. In the face of increased food stamp demand that was really unprecedented in this state, Oregonians are now receiving their benefits 9 days sooner than they were before. And in the vast majority of places in the state, it's same-day service. As Catherine Phillips, a new food stamp client, leaving one of our branch offices here in Portland, was quoted in the local newspaper. She said, quote, "I get to walk out of here and go to the grocery store." Our customer satisfaction rate is now 98% in our food stamp program. And not only that, we didn't sacrifice quality as we got faster. We actually improved quality. We just received an audit report from the U.S. Department of Agriculture showing that our accuracy in determining income and eligibility and all the things we look at when we enroll people was better this past year than in the year before. So we not only kept our heads above water, but we made our services even better. This is really about changing government, and this is about how we change lives. And, I'm proud to say that in the face of what's been a year of absolutely unprecedented demand, because of our ability to use resources more efficiently, by being better fiscal managers, by instituting a hiring freeze and other cost-cutting measures early in this economic crisis and anticipating it, we were able to end this current biennial budget just on June 30th balanced. It's a remarkable achievement by everybody in our agency. And the goal is simple. It's about doing work the right way while getting the most out of the public dollar, so we can better target those resources towards services. We've got more than 80 initiatives, like what I talked about with food stamps, underway in our organization, and 2,000 people have been trained in the lean way of working. Some improvements are going to be big, some small. Some are going to save lots of money. Some are going to save just a little bit, but mean a lot to the people involved. And as I think with any large undertaking, there's going to be setbacks, and it won't all go perfectly. But I can tell you that even the most conservative legislator in the legislature is excited about what we're doing. And our employees are leading not just a series of process changes, but what really is for our organization a culture change. And here's why we've got to improve. Because the work we do, as I've outlined, is simply too important to Oregon not to. We have to be the best. 90%, it's actually over 90% of the state budget, of the general fund budget, goes in three areas. It goes to education, human services, and public safety. The Department of Human Services share of that, we're about 25% of the state budget. We provide one-on-one direct services to over 1 million people in the state almost every day. That's less than 1 in 4 Oregonians. We do that by providing job skills training. We help parents who are struggling get a hand up. We provide health care to nearly 500,000 people on the Oregon Health Plan. We care for seniors. We provide support for developmentally disabled adults so they can live independently. And then we provide services for everybody in the state. Through our public health programs, we assure that the water you're drinking here today is safe and clean, and that the water that's coming out of your tap at home is safe and clean. And we're helping the state prepare for what is the potential of a statewide H1N1 flu pandemic this coming fall. But the remarkable thing, and this is probably the thing that startled me the most when I joined the Department of Human Services, is that we don't do it alone. In fact, contrary to what you think, we do very little of that, those who work in the agency. Only a small portion of our budget goes to DHS staff or our overhead. 85%, just about 85% of our budget is spent out in the community. It goes to pay for the services that are delivered in the state. We write $13 million of checks every day, about $5 billion a year. And where that money goes to isn't to us at DHS. We pay small businesses, we pay hospitals, doctors, nursing homes, foster care providers, we pay mental health treatment facilities, we pay home health care workers all across the state. We pay small businesses like the Shangri-La Corporation based in Salem. This is an organization that provides job training and residential treatment for people with developmental disabilities or mental illness. They do this in multiple facilities around the state. We pay doctors like Chuck Hoffman, an internist in private practice in Baker City, who treats Oregon Health Plan clients. We pay Phyllis Wagner, who's a foster mom, who for 35 years, this is an amazing woman, 35 years has been caring for medically fragile foster children in her home. We have an impact. Not only do we have a human impact, but as you can see, we have an economic impact in every town, in every community in Oregon. We account for 1/3 of the health and care and social assistance domestic product in the state, and we account for 55,000 jobs in Oregon. Most of them go into small businesses and to nonprofits. In some parts of the state, local hospitals and local human service providers, nonprofits, are often the largest providers in town. Certainly in many rural communities, hospitals are the largest providers in town. So not only are human services important for improving people's lives, but they're also part of the economic cornerstone of our state. So let me get back to where I started. That's why we've got to do things better. But here's the last part of this and the last point, because we've been talking about us. Now I really want to switch the tides and start to talk about you. If we're truly going to help people and support our communities, we need to do more than transform our government. We've got to transform how we and how you think about government and what you and what we want government to do. That means confronting and taking on root cause issues, innovating, preventing problems early to avoid costs further down the road. So let me talk about just 3 ways that we can transform our communities, improve our health, and get better value for our public investments. Number 1, we need to invest in community-based mental health and addiction treatment so that everybody who lives in our state who has mental health or addiction problems should be able to get community-based treatment. Number 2, we've got to make health care affordable and available for everyone. But that's not enough. We also have to transform our health care system to get better value and so that it works to improve our health. And then 3, we've got to focus on healthy aging and keeping seniors at home and in their communities. If we can do these 3 things, we can have a profound impact on our state. Let me tell you why. I listen every week to the City Club forums, and I know that over the last couple of weeks, you've had some very distinguished guests. You've had Governor Kitzhaber and Attorney General Kroger. And it wasn't lost on me, and I hope it wasn't lost on you, that they both spoke about how important early intervention and treatment are, whether it's for individuals who need addiction treatment or health care for families who are on the brink of disaster. So let's talk about mental health and addiction treatment first. And let me be really clear about this. Untreated mental health and addiction problems, they drive our business at the Department of Human Services. They're amongst the single greatest cause of child abuse, poverty, and homelessness. It causes families to crumble and lives to collapse. And unfortunately, the way we approach this as a state and as a community isn't working. I don't think anybody can stand up and say we're doing this right. As I already mentioned, substance abuse costs us all $6 billion a year. Yet despite the fact that for every dollar we invest in substance abuse treatment actually provides a return of $4 to $7, we continue to invest in the destruction that addictions cause rather than in treatment. This, my friends, just makes no sense. Consider this. 60% of children who become known to us in our child welfare system are there because their parents have an issue with alcohol or drugs. 60%. We're paying $24,000 a year for every child that comes into foster care, rather than paying $2,000 to $3,000 to treat a parent. And once that child enters foster care, they face huge barriers to success, no matter how great that foster care is. And we have wonderful foster parents in this state. But they're more likely to drop out of school, less likely to go to college, more likely to go to prison or to become a teen mom. Imagine how many people we could save, how many families that would remain intact, how many more college graduates in the state that we would make if we just made smarter investments early on. Now, I know there are a lot of causes of child abuse. But one thing's clear, making investments in the root cause issues like parental addiction and preventing kids from being abused, it makes a whole lot more sense than taking care of abused and scarred children. And it's not, this is not just simply a moral thing to do. It's a better way to use our state resources. The same is true, as I mentioned, for community-based mental health services. Early, readily available community treatment not only improves lives, but in the long run, it's a much more cost-effective way of dealing with the issues that confront people with mental illness. So let me turn to health care, and it's in many ways a similar story. It's not lost on anyone in this room that healthcare has become so expensive that too many families can't afford it. And as more and more Oregonians are out of work, more people are losing coverage, more children are losing coverage. You know, fortunately, last month, the governor, the legislature, hospitals, and insurance companies really stepped up to the plate and put together an innovative package, the Healthy Kids Plan, that's going to make sure that all children in Oregon have access to basic health care. This is a great start. It's a phenomenal start. And wait, there's more. We also added 35,000 people to the Oregon Health Plan. What's really remarkable about this, and why we shouldn't only clap, we should get up out of our chairs and rejoice, is that we did this in the face of what is a historic recession. And I believe that we are one of the few states in the nation that's moving forward in providing basic health care to our citizens, as most other states in the country are cutting back due to budget problems. So this is truly historic. In Oregon right now, children will get the care they need to keep them healthy and have them grow up strong. They'll be able to get the dental care they need so that they don't get chronic dental caries. Their mental health and behavioral issues will be properly addressed so they can do well in school. And they'll be able to get eyeglasses that will, if they're anything like the ones my folks got for me when I was younger, will both mortify them as well as help them see the blackboard. And that's going to help them do real well in school. In Oregon, children will no longer be held back from reaching their full potential because they don't have health care. This is a remarkable achievement, but it's only a start. Despite this, as I mentioned, too many people in our state don't have access to basic health care, 1 in 6 adults. And that fact really stains our entire society. We all know the issues. Health care is too expensive. It's too expensive for employers. It's too expensive for individuals. It's consuming far too much. It's making the Oregon Health Plan more expensive. The state can't afford it. It's not sustainable. We simply can't just cover more people in this broken system. We've got to get a handle on the high costs. We've got to get the right care the right way to the right people. And we've got to focus on root cause issues. So again, root cause issues. Consider this. Right now, almost 3/4 of healthcare costs are accounted for by obesity, heart disease, diabetes, certain cancers. Most of those last 3 things caused by obesity. And what they all have in common, all these things, is that they're largely preventable. And some things even reversible by changes in nutrition, physical activity, and lifestyle. It's simply not enough for us to extend insurance to treat people for illnesses that we can prevent. We've got to change our whole system and turn it around and provide an emphasis on prevention, on primary care, and on public health. And when we need treatment, we've got to be certain we get only the things that work to treat people and keep us healthy, not the healthcare industry. Almost 25% of care that we currently get does little to improve our health. That, along with the administrative waste that's in our system, the costs that we all experience, whether it's in trying to figure out a healthcare bill, whether it's trying to figure out where to go to for care and how to get there and to navigate the system, all of that has to go. It's amazing. You know, we have now a simple pill that can cure several cancers. It was actually invented here in Oregon at OHSU by Dr. Brian Drucker. It's truly remarkable. But we have a truly complex system that you have to make it through to get that simple pill, if you can get it at all. And good luck to you if you can figure out how much it costs. There's a better way to do this. Thanks to the hard work of folks like Representative Mitch Greenlick and Senator Alan Bates and many others in the legislature, there was a piece of legislation that was passed that's going to drive a healthcare agenda to contain costs, improve healthcare quality, and assure that everyone in this state gets basic health care. It establishes the Oregon Health Authority, which is charged with giving us the tools to shift the state's approach to health care towards an emphasis on primary care and prevention, on administrative simplification, on cost containment, and on evidence-based outcomes. In essence, it's really about fundamentally transforming the way we finance and deliver health care in Oregon and assuring that no one's going to be left out. And it positions us perfectly to take advantage of what will hopefully be some national health care reform. And that's a big charge, and I mention it today with some trepidation because just this past week, the governor's asked me to help lead that effort, and hopefully what you'll do is have me back here at some point in the future to talk about that in a little bit more depth. So let me finish with seniors. In Oregon, we have a tremendous system that cares for our seniors. We believe that people should be allowed to age in their own homes and in their own communities. We want that for our parents, and when it's our turn, we want it for ourselves. We've got a rich tradition of providing in-home care and community-based services like foster care that allow seniors to stay safe and independent. In fact, we have one of the lowest, if not the lowest rate of seniors who spend their last years in a nursing home. We jockey with Alaska for who's keeps the most people out of nursing homes. But I'm worried that we are not adequately prepared for the aging demographics that I mentioned earlier. Our investments aren't keeping up with the population growth. And no matter how efficient we get, if we don't start preparing today for our aging population, our seniors are going to lose care. We need to assure that these home and community-based services are available for seniors, and that what we do is focus on healthy aging and on maintaining function for our seniors. We're right now at a pivotal moment in our state, and we have an opportunity to really continue an Oregon tradition of independence and innovation. But as I said, it takes asking ourselves some difficult questions. What does it really take to create the kind of state that truly supports all of its citizens? What does it take from government? What does it take from you, the people? Are we passing the moral tests that I spoke about earlier? In some places, as I've laid out, we're actually doing better. In others, we've got a long way to go. But I think there's a path here, and that by being smart and strategic, if we take it, we can get there. By investing in what works and stopping what doesn't, by demanding more from ourselves and more from each other, we can do this. The need is great, and I'm not trying to underestimate any of the challenges here, but I'm really optimistic. And let me give you another example. Look at the legislative session that just ended. We faced a $4 billion budget shortfall in this state. And I know because they told me that lawmakers, their phones, their emails were a buzz with communications from Oregonians who wanted to protect basic health and human services. They wanted to help their neighbors, their children, the disabled, and the unemployed. Oregonians didn't want to balance the budget on the backs of our most vulnerable. So when the state was facing what was really an unprecedented increase in need and an unprecedented loss of revenue, the legislature stepped up and did the smart thing. Legislators like Senator Margaret Carter, who's here today, who really stepped up and led that charge. If you think I've got a tough job, try being the Ways and Means co-chair of the legislature in the face of unprecedented loss of revenue and unprecedented increase in need and demand for state services. That's a challenge. And Senator Carter and the rest of the legislature stepped up. As you know, part of the federal stimulus package that came to states was supposed to help states meet the human service needs brought on by this recession. And that's what happened. Lawmakers set priorities. They targeted services to getting Oregon through these difficult economic times, and they're doing that. That meant some cuts were made, and some services were postponed. And there's no doubt that's going to have a real impact on people. But overall, we did not go backwards. We didn't go backwards in how we protect our seniors and our children and people who are disabled. And when it comes to health care in some areas, we began to move forward. These are smart investments, and they're going to save money, and they're going to rebuild the public's trust. And I think as we look to the future, and we look at the type of state that we want Oregon to be, we've all got an important job to do. Our job at DHS, we know what that is to keep getting better at what we do so that the trust that the public has in us is deserved, and we need to be better stewards of the public dollar so we can serve more people. As we move forward with our initiative to make ourselves better, to transform ourselves, we're going to have better results to report. But I hope I've made it clear, we're just a small part of this. Without small business owners and local communities and without the people in this room, we can't get the job done. So I'm asking for your help, and your help in helping us do the right thing, in making the smart and early investments that are good for families and good for the state, in helping us get at the root causes of things like drug and alcohol abuse, mental health care, preventable diseases that drive up health care costs, and early in-home care for seniors. We can, I believe, change government and change lives. But we can only do that if it's a government that really works for and with people. How we care for people who are in the dawn of life, the twilight of life, and in the shadows of life is really a moral test for us all. And in Oregon, I think with a little bit more of work, I believe that we can meet that test. Thank you very much.
The first question for our speaker, as always, will be from our Board of Governors host. Today, our board host is John Horvick. John is the project director for the Parents and Children Together study at Oregon Health and Science University. He joined City Club in 2004 and is currently the vice chair of the research board. John?
Thank you very much, Dr. Goldberg. I'm hoping to get you to expand a little bit on a topic you just briefly mentioned in your speech. You recently served on the state's Task Force for Comprehensive Obesity Prevention. The task force report notes that 61% of Oregonians are overweight and obese, and that obesity costs the state $781 million a year. I don't have time to mention all the policy recommendations, but they include $10 million in annual spending for the state to help coordinate anti-obesity programs. However, the report also says this is, quote, by no means enough to stop this epidemic, end quote, and that a new funding source will have to be identified. Where should obesity rank as a priority for health spending in Oregon, and how would additional funds be used?
Well, you're touching upon something that I'm deeply interested in. There's no doubt, as I indicated, where should obesity rank? It is one of the most pressing public health problems that we face in our state today. And if we don't do something about it, we're in economic trouble and we are jeopardizing all of our health. Consider this. Right now, the current generation of children that are growing up are likely to live a shorter lifespan than those of us in this room today, the adults. And the reason for that is childhood obesity. And this is probably the first time in recorded history that the next generation is likely to live shorter than the previous generation. Generally, we all try and make a better life for our kids, but due to what's happening not just with obesity in adults that's causing diabetes and high blood pressure and heart disease, our children are growing up unhealthy. And this has to be a priority for our public policy in the state. We've got to make investments in it. This is one of the root cause issues that I indicated, that we've got to be able to take a comprehensive approach. We need to change public attitudes. We need to do some of the things that fortunately have begun here in Oregon. This past legislative session, the legislature passed a menu labeling bill so we can have information at the point of sale that we buy food. We have to invest in comprehensive community and statewide obesity prevention programs, much like we did with smoking several decades ago when that was thought to be a norm and half of our population smoked, and now we understand this is a public health threat. We can reverse these things if we make the investments in it. It's about assuring good physical education in our schools. We're terribly lax in being able to be certain that kids get physical education in our schools. Kids in daycare are tied to televisions and screens. They need to become more active. We need to take a totally comprehensive approach, and I believe if we do that, we as a state can do something about this. We've done it with other public health problems. We've done it with smoking. We've got to re-engineer our communities. So, you know, I think it was about 20 or 30 years ago, over half of kids in this country walked to school. I walk to school. I tell my daughter that every day. Knee-deep snow, no shoes. I trudged to school. It was a tremendous hardship. Now kids, they don't do that. In fact, you know, less than 20% of kids walk to school today. They're not getting physical activity, and they don't walk to school often because the communities they live in don't have sidewalks. Where I grew up, we had sidewalks. We could walk to school. So there's a lot we can do. I think this is a huge priority for our state and for our nation, and hopefully we can continue to move this agenda forward.
We'll now take questions from the floor. Asking questions at a Friday forum is a privilege of club membership. I'd like to encourage all of our members to take their turn at the microphone and ask questions, and particularly encourage those of you who've never done so to step up and take your turn at the mic. So when you ask your question, please identify yourself as a City Club member, ask your question in 30 seconds, and then please ensure that it is in fact a question.
I'm Fred Mathis, and I'm a member and a retired academic pediatrician and family doctor.
Great.
Dr. Goldberg, you mentioned root causes and you mentioned stopping what doesn't work. We have a shortage of primary care physicians, as you know. Are there officials from the state having any dialogue with people from the medical school in this state about the possibility of curtailing the production of subspecialists that we don't need and possibly converting some of those resources to the training of primary care physicians?
You know, I think you've hit on an important problem as we do a couple of things. One, if we're going to bring more people into our healthcare system that are currently outside of it, we need a workforce to take care of it. And number two, if we're going to have the right kind of healthcare system that focuses on primary care, where everybody has a primary care physician, nurse practitioner, physician's assistant, we're going to need many, many more in our state. And so this is something we clearly have to look at. We're going to be doing that over the next 2 years as part of the Oregon Health Authority. We are looking at both a couple of things. Better looking at how we can determine the kind of workforce that this state's going to need out into the next 10 years, and at the same time look at what kind of policies we need to get the right workforce. You know, I think there's some areas of specialties that we have too many of, but there are some areas of specialties in the state which we have too few of. So I don't know that the answer is simply just about less specialists and more primary care, but it's certainly we need more primary care physicians, we need more primary care nurse practitioners, physician's assistants. We need to pay primary care differently. That's one of the reasons, I mean, this is a complicated problem, and one of the reasons we don't have the kinds of primary care docs that we need is, as you mentioned, our medical schools aren't producing enough. We've got to change medical school curriculums. Number two, when medical students come out of medical school with debt, They need to be able to be fairly reimbursed so they can pay back that debt, and that's driving many to go into high-priced specialties as opposed to primary care. There's some ways to do this. You know, when I went to medical school, I was part of the National Health Service Corps, and I had my medical school paid for by the federal government and became a primary care physician, which you had to do to be part of this program. And I worked in an underserved area. And this was a way, A, I came out of medical school without debt. B, I contributed back to my community. And we can set up programs like this in Oregon and the nation once again to get more young healthcare professionals into primary care. We need to change the reimbursement structure so that a half hour of a neurosurgeon's time isn't worth any different than a half hour of a primary care physician's time. This is valuable time. And if we do that, I think we can make a stride at this.
But I'll take that as a no, that there is no dialogue.
Oh, no, there is dialogue. There's actually a tremendous amount of dialogue with the medical school, where I still maintain an appointment, and our Office of Health Policy that's working very closely with them.
Hello, my name is Sharon Joy, and I am a member. I have been in a wheelchair for 33 years, and before that, sick with MS, so I don't get much exercise. But I have had a lot of experience with a lot of government agencies, and I can testify I am stunned at what your organization does. It has saved my life so often that I appreciate it more than the Social Security and the housing and the TriMet, and that's saying a whole lot. But what I really wanted to say, just because you mentioned Toyota, my son is a troubleshooter for the Western Third, and my brother worked in the World Health Organization on the panel of experts in the Asian sector. So I'm very interested even in my area. And one of the things that we need the most, which would be the healthiest thing for us, is work. And I'm not saying paid work, but just work so that we feel worthwhile in areas that we know, and we know our disease. So if we can make our government where we can help pay for our services, I would very much appreciate it. Do you think it's possible?
Well, the answer to your second question is brief, which is yes, but more importantly, let me start by thanking you. That was really one of the nicest tributes that you can get when you do the kind of work that we do, and to hear you talk about what we've done as an agency to help improve your life is really why we go to work every day. And I think that all of the 10,000 people who work in our agency would be gratified to hear what you had to say. And so thank you. We're often pretty quick to criticize ourselves, and often we're pretty slow to say thanks. So I really want to say thank you both for recognizing what we do and what's a great idea. I think you're right that we all need to feel valued and useful. We want to feel valued and useful in the jobs that we do every day, and we want to feel valued and useful if we don't have something that pays us for employment, but that allows us to contribute to our communities. And I think that there are ways that we can do that. There are ways that we can invest in the kinds of programs to provide support and training and to help individuals contribute to their community, and we can do that. Thank you.
Mark Anderson, member. Mental health, comparative effectiveness, evidence-based practices, local service delivery, especially the Portland metropolitan area. How are we doing, and how can we do it smarter?
Well, we're going to have it all done next week.
Give us a preview.
We're right on track, and I think there's a couple things we can do. And if we focused on just these two things, I think we'd come a long way. You mentioned comparative effectiveness work. I mean, this is something that in many ways, it's another great Oregon tradition. A lot of this began here in Oregon, is really looking at medical care and looking at what works and what doesn't work. We need to do two things around comparative effectiveness. One, we need more information about what works and what doesn't work. Many of us who are physicians get told what to do, but not necessarily what works and what doesn't work. But it's not just about having better information. It's about having that information available to doctors and nurses at the point of decision making. Because there's volumes and volumes of information out there. So if we could invest in greater amounts of comparative effectiveness research and make it available at the point of decision making, I think we would come a long way. And I think the second thing that we can do, and particularly you mentioned in the metropolitan area, we've got to change the way we think about and deliver health care and deliver this as a metropolitan area. And to think of the Portland community as a community and what is going to help and keep Portland healthy and individuals healthy and have actually a discrete population that we know how to take care of. Right now we have a very disjointed healthcare system which focuses on individuals, not communities, doesn't make the kinds of investments in public health that help keep communities healthy, and that's really focused on a person, and that person oftentimes interacts with multiple disjointed segments of that healthcare system, whether it's 3 different employers when you change your job and 3 different health insurers every time you change your job, or 4 different hospitals and 6 different doctors. We've got to create an integrated, community-based system that's accountable not for what it does in terms of the amount of things that it does, but that's accountable to the health of all of us, that helps be accountable to the health of Portland and the health of everybody in it. If we did those 2 things, we'd be light years, and give us a month and we'll be there.
Well, we've run out of time for further questions and I'll have to stop for this week. Please join us on July 17th for an address by Portland Community College District President Preston Pulliams. And as we close, please join me in expressing our appreciation to today's speaker, DHS Director Bruce Goldberg. Really, John.
Thank you.